million patients.
Okay.
Okay, so it found out that about four things were showed some significance. Low salt diet showed showed moderate evidence that it actually reduced death. Omega-3 fatty acids actually show that they also have a small chance of reducing heart disease and the chance of you having strokes. Something called folate or folic acid can also reduce chance of you having strokes. And we know that in pregnant women, it reduces what are called neural tube defects or birth defects.
Okay.
But though anybody with diagnosed cancer, we try to avoid folic acid because it can actually cancer cells need folic acid to to divide quickly. So we try and restrict folic acid from anybody that has cancer. It's which a lot of people don't know.
Don't know.
Yeah, so I see a lot of patients, a cancer diagnosis, they grab one of these blood tonics with folic acid in there and just
causing more harm than
yes,
good.
yeah. So you just need to be careful about that. And the other one, calcium and vitamin D, were shown to decrease chance of having stroke, as well as we know as building blocks for healthy bones. And the other research showed that calcium and vitamin D work better when you take magnesium with it.
All right. So yes, still talking about supplements. There are misconceptions about vitamin supplements. I'd like to know what they are.
Yeah, the misconceptions are like they're magic pills. I get a lot of patients that come in and say, "Oh, let me, what supplement should I take? What vitamin should I take? If you're really, a lot of times I tell them save your money and use it for. I saw somebody they bought 65,000 naira worth of
Supplements.
from one of these MLM companies, multi-level marketing companies. I won't mention the name, obviously. So I saw the bag and I was just dumbfounded that okay, who told you you needed all these supplements? And I said, do you know with 65,000 naira you could have done your cholesterol, ECG, heart check, colon. I mean, you could have done prostate. You could have done all your checks for the year and then know if you definitely need anything at all. So a lot of those misconceptions are that it's it's a magic and a pill and it's a cure all. I personally take supplements every day. Okay, I take saw palmetto, reduces prostate disease. I take coenzyme Q10. These are not brand names. These are names of minerals and supplements. I take glutathione, and I take a one a day men's vitamin, and I don't play with them. I take them every day because they can hurt. They can hurt me, but I'm not telling everybody to run out and start getting them. The best thing
you have to find out what works for you best.
Exactly.
What prescription from the doctor?
Exactly.
All right. Okay. So going back to the phone lines and the text messages. Let's quickly. Okay.
So that's
yes, I've heard that. But,
yes. So
depends on
all jokes aside, the IUD or IUCD, they have different types, and I'm not sure which one she has, but some of them have hormones inside.
Oh yes.
So some of them are copper, which is the prototypical one, but some of them have progesterone, or different hormones, and those hormones can actually make you increase your appetite and make you eat. So maybe she can call. We'll talk about the one that she's on. When we're not on the air.
Okay. All right.
Raw onions. I can't. How many? How many onions are you taking? There's nothing wrong. I mean, there's nothing wrong with eating onions. So I can't really answer the question. I'm sure it's not bad for you, but I don't know how many he's eating. and I'm not exactly sure, how it actually helps your body.
Okay.
Some new research just came out about turmeric, nutmeg,
Oh. Okay.
cayenne, that they're actually quite useful. But for onions, I honestly
No, not so sure.
don't know off the top of my
Okay.
head.
I have heard of turmeric to this message before.
And there are a lot of different causes, and there are a lot of solutions. The good news is that there's hope.
Okay.
Okay. But I really need to have a detailed history. If she can encourage him, the best thing she can do is encourage him to come for a consultation, and the two of
Okay.
them should come together. So we can now talk about strength of erection. We can talk about their interpersonal dynamics, and also talk to him about whether or not he has any psychosocial stressors in his life.
Okay.
So, but I have a lot of different treatments that will work for him. But I also like to get a good history before we do that. So, try and make an appointment.
Okay. So, yes, money do also reach.
Glaucoma and cataracts. That's unfortunate. You have both